Bonjour à tous. Au nom de Metrovision, je vous souhaite la bienvenue sur ce webinaire et vous remercie de votre présence. Nous travaillons avec la société FORUS et distribuons leurs produits depuis 2 ans déjà. Et nous sommes heureux d'accueillir aujourd'hui leur spécialiste d'applications cliniques, Donny THOMAS. Donny, can you please share your screen now?
Okay, thank you very much, Fabian, for the brief introduction. My name is Donny THOMAS, and I represent the company FORUS HEALTH. We are based out of Bangalore in India and San Leandro in California, US. In today's presentation, I'll be walking you through the details of a very specific camera that we have developed that is used for imaging the retina of newborn infants. So the idea is to take you through the process of screening and why this camera makes a difference when it comes to effective management of eye diseases such as ROP and retinoblastoma. Globally, there are about 15 million babies who are born too early. By that I mean they're born premature. And roughly 10% of every babies born in every country are premature babies, and they have to go through a neonatal intensive care process for them to survive, or for us to take care of them and make them survive. And that is a good thing with respect to our technology, making it available for us to save the babies who are born early, but they also come with some side effects, and that can lead to certain diseases in the eye also. So we'll be very specifically dealing with only that aspect of the diseases that happen to the eye as a result of a baby receiving intensive neonatal care. So the condition that normally develops in babies who are mature and who go through a intensive neonatal care is called retinopathy of prematurity, or ROP. And one of the primary reasons is the prolonged exposure to supplemental oxygen. And this basically results in abnormal vessel growth, blood vessel growth. And as a result of that, there's detachment of the retinal tissues, which is the lining in the back of the eye. And this can lead to permanent blindness in babies. And this is something that needs to be screened very frequently and periodically at the time of neonatal care. And there are different methodologies that has been used earlier for screening ROP in NICUs. Some of them are very effective, but there are certain challenges with respect to doing the screening periodically in NICUs, considering that most of the premature babies now survive because of the technology and care that is available in most of the healthcare systems. Interestingly, this condition is preventable if it is detected early enough on time, so that the proper intervention with respect to treatment, surgery, etc. can be provided. So it is unavoidable with respect to our ability to prevent it. We are able to prevent ROP if we can effectively manage it early enough. So let's take a look first at what are the current ROP screening methods that is there. Primarily, ROP screening is conducted by an ophthalmologist, and because they are trained to look into a baby's eye, more importantly, they are trained to look into any human eye, but there are doctors who are very specifically trained to look at babies, and they have to use an equipment called a binocular indirect ophthalmoscopy, as most of you would know, and scan through the retina, which is the back of the eye, and come up with a diagnosis based on the subjective method of seeing through the particular ophthalmoscope. Now, the biggest challenge here is there aren't too many ophthalmologists who do ROP screening, and that can be a challenge in countries like India or some parts of Asia and Africa, where the population is very high and the number of doctors don't necessarily meet the demand of the number of babies being born. So it is not going to be very easy for them to be physically present to conduct these kind of testing at the NICU. So that's one of the major challenges that we have seen, especially in the emerging markets where ROP screening either doesn't happen or happens in a very small way. So this is something that is because of the fact that the screening is constrained to certain methodologies. Now, if you're able to find an alternate method to look into the baby's eye and record those events and then share that with a doctor for further review, that might be a good idea of doing remote-based screening of ROP. So what we have developed is a wide field imaging system that takes a 120-degree field of view image of the back of the eye. And you can do multiple angle imaging, which means you're not just doing a macula center or an optic center image. You can actually move the camera in different angles and capture peripheral photographs also. Now, there are many advantages of using a camera like this. We can actually train the technicians at a NICU to photograph the baby's eye and use a telemedicine platform to transfer the images to a ophthalmologist who can do the screening or a review of the and diagnosis of the eye remotely. And this is very effective when it comes to the ability of the NICU to independently do it. Plus, the ophthalmologist can effectively look at the eyes and doesn't have to really physically travel to these locations. And this actually is an advantage in today's scenario, where the NICU has to be very well protected from the risk of any kind of transmission of the COVID-19. So making the NICUs independent and having the doctors to do remote screening is a very, very important tool or need of the hour, as we can say. This makes, so the one thing that we have to realize is we cannot delay ROP screening because the window in which we have to do the screening is critical, and the screening has to happen, and delaying it will lead to irreversible consequences with respect to the baby either going blind or having to go through severe vision loss. We will talk a little more about telemedicine in the next couple of slides, but having the ability to photo document the event also is an advantage because you have a permanent digital document with respect to the diagnosis. So any point in time, if the parents or the baby want or the child wants to come back to a diagnosis and look at what's there, the documentation is available. This also helps in many medical legal confrontation that has happened in the past. So having a permanent photo documented evidence is very, very critical when it comes to protecting your practice and your ability to defend your diagnosis. So telemedicine, wide field imaging, photo documentation, these are all the advantages of doing an imaging versus using an ophthalmoscope. So it doesn't mean using an ophthalmoscope is bad. It's very effective to use an ophthalmoscope as long as you're an ophthalmologist. The point is, if you want to do mass screening and scale the program and do more babies, and also to do photo documentation and record the evidences, you will have to use a system like a wide field imaging system. And that is what we have developed. And there's a reason why our devices are very different from conventional cameras, and that's the next session that I'll be dealing with. Before I go there, I also have one slide to talk about the preparation of the babies. If you are experts in doing ROP screening, you will know how it is, but I still thought I will cover that section also here, where the baby is properly wrapped and we use a speculum to keep the eye open. And the most important thing, we use a gelucine kind of substance to apply on the baby's eye to protect any kind of aberrations between the camera and the eye. This is a contact device, which I'll be dealing with later, but it's very important that we have the medium between the baby's eye and the camera. So these are some of the preparations that we do before a proper screening is conducted.